Welcome to the Canadian Powerlifting Podcast, the bi-weekly show that brings you the best of powerlifting in Canada. Our three co-hosts include Ryan Stinn, holder of the heaviest equipped squat in total in Canada, as well as owner of Unparalleled Training Center and co-owner of Inner Strength Products. Steve Cassioli, IPF world record holder and medalist, the third strongest classic lifter in Canadian history, and owner of Cassioli Strength and Conditioning. Lastly, Avi Silverberg, world team coach and world bench press medalist, owner of PursuitOfStrength.com, a site dedicated to coaching and education for powerlifters. Today's episode starts right now.
Season 2 of the Canadian Powerlifting Podcast is brought to you by LVD Fitness. LVD Fitness is a powerlifting apparel brand that donates 1 month of clean water to a child in need for every item sold. Follow them on Instagram and Facebook at LVD Fitness to join the movement.
And you come to these events and you help everyone, right? Anyone who asks you. In fact, this year at Nationals, at our hosted Nationals, I saw you helping the security guard. The security guard asked you some question about his back or something, and you were helping him. Yeah. So, I mean, you're a very unique resource that we have in powerlifting.
I think, unfortunately, I get something by human nature. People chase pain. So if someone says, I'm sore here, they rub there. So, but I always ask myself why. Ever since even I was in school at chiropractic college, even when they were teaching chiropractic college, I say, well, why is this happening? And no one can answer it. So I've just been working on why. If the room is dark and you go you go and change the light bulb with a bigger light bulb and it's still dark and you're flicking the switch, the problem's not the light bulb. It's the switch. It's the wiring to it.
Hello and welcome to the Canadian Powerlifting Podcast, episode 3 of season 2. Welcome. I have to say, guys, that this episode that we recorded was probably my favorite episode that we recorded so far out of all of season 1 and all of season 2. Absolutely fantastic information. I can't wait to play the recording here for you. We sat down with, well, Ryan, who did we sit down with?
We sat down with Aras Kvedaras. Kvedaras.
That's it.
It's a tough name to say. And
now, for those of you who don't know Aras, what's he about? Well, who is he?
He's a chiropractor by training, but he is a lot more than that. He's a guy who's taken an interest in powerlifting. He trains it a little bit himself, but he'll get into the story of how he got into powerlifting. But he's been around the sport for I think going on 15 years now, and so he has just this deep knowledge of the movements and the mechanisms that are involved. And he's been to every nationals but one since 2006, I think he said. So I mean, he's seen such high-level lifting that he's probably helped, I don't know, most of the top athletes in the country. If you don't know who he is, it's probably because you haven't been to nationals. If you've been to nationals, you've probably seen him around. You may not know who he is, but you probably saw him making someone hurt somewhere, jamming a finger into an armpit or into a neck or something.
Yeah, you guys are going to find out about his unique approach to training, and he has a bit of a mixture of protocols, and he made his own little blend there, so you guys are going to hear a lot about that.
And the blend is really around his deep knowledge of powerlifting, just being involved in the sport for so long. He's come up with this very unique framework of how to actually assess and then treat powerlifters specifically. So he has some really great information in that regard. And not only that, he talks about some things to do on competition day, some things to avoid, some things to do in your own training that will really help you kind of set you up for kind of a pain-free athletic career, and obviously avoiding injury. And there's some quite interesting misconceptions around some of the things he was saying. He has some quite strong opinions that are kind of backed by his experience in terms of what you should and shouldn't be doing. So I can't wait to play that recording for you. But first, we got to roll into our bi-weekly powerlifting wrap-up.
All right. Well, this week with news, I don't have much, but I did. I was going to go on a little rant here, I guess. I ended up hurt my back last week, tweaked it a little bit, So I haven't been squatting and deadlifting, but I have been doing a lot of biceps and tricep work. I know a lot of people like using dumbbells, barbells, and all this stuff, but you know what? 2 exercises that you have to try next week that you probably have done in the past are chin-ups and just your regular push-ups. Now with these 2, I know you guys are like, oh, this is so easy. That's not powerlifting movements. Hop on the chin-up bar and try doing 3 sets of 10 with a 4-second eccentric count. Also, do your regular close grip push-ups and do that with a 4-second eccentric count, and then tell me how your biceps and triceps feel, because I know it might have grown at least a few inches the past week. What do you have for us, Ryan?
Well, I'll tell you, I can't do 3 sets of 10 chin-ups. I'll tell you that much right now. So I don't have that. I'm going to cover a little bit on the hashtag. Some really crazy lifting going on across the country with a lot of people prepping for Worlds. Eric Willis, lifter from Ontario, the winner of the 120 category at Nationals in the open class, hitting a 500 Wilks there. Hit a squat triple at 275 kilos. I know he went for a little heavier for another triple, I think around 290 or something like that. I mean, the guy's a very good squatter, and I'm really hoping to see something huge from him at Worlds. Screamer Stephen Manuel. If you don't know who Stephen Manuel is, he is one of the top lifters in the world, winner of Worlds, and member of the Great British powerlifting team. Tagged us in a hashtag, so I had to kind of yell out to him. I don't know if he actually listens or if he just found a hashtag and tagged it, but big 300 kilo pull the other week, and he is training for Worlds, and yeah, he's definitely one to watch for. My own training partner trained today, kind of post up everything, and Mel Ziffel squatting 145 kilos for a double with a belt, and then deadlifting 157.5 kilos for a double with just a belt again. I told her she has to do a raw meet. She's in the 63 kilo class right now. She's a light 63, but she hasn't really done a raw meet, so I told her it's time for her to do that after Joel Bouillon called us out on Instagram for the strongest raw gym in the country. So I need some more of my lifters to do some serious raw lifting. And lastly, Bryce Krawchuk pulling sumo, which is wonderful. And then even better, though, he did it in a pair of suit bottoms. So he says he's going to do some equip lifting after Classic Worlds, and I'm really excited to see what's going to happen with that. But I don't know if Bryce is actually going full sumo for Raw Worlds, or if he's just, I know he's training around an injury right now, but Bryce Krawchuk always pulling something big no matter what way he's doing it. I think he's over 300 kilos in sumo already. So that's what I got. Avi, what do you got?
This week, I'm going to be covering the junior team for the World Classics in Texas. And for those of you who don't know, I was named the head coach specifically for the juniors, sub-juniors. So looking forward to working with this group this year as we move into Texas. Junior women, got quite a few experienced athletes in this group here, and some that only compete at nationals for the first time this year. So quite a range in the experience. In the 47s, Delana Rule, 52s, we're sending 2, Nicole Pavagalenti and Samantha Soli, who's been to Worlds before, Kelly Lee in the 57s, Alexandra Stoldaka in the 57s, Jessica Butner from Saskatchewan, the massive deadlifter. Holy cow, watch her come guns blazing down in Texas. Sarah Cowan breaking some unofficial world records at her provincials earlier this year, so she'll be primed for one of the top spots. And Janessa Ward in the 84 pluses. She's been to Worlds now for the last 2 years, and good to see her back on the team. And we can't forget our only sub-junior female athlete, Camille Tremblay from Quebec. You mentioned Joel Bouillon from Quebec. She's from Quebec, and she has been putting up some unofficial world records as well. On the men's side, we have quite a few sub-juniors, 4 sub-juniors to be exact. Riley Bullitt, Eduardo Platt, and Noah Ukrainets, and Cameron St. Amman. Cameron has competed a couple times internationally, but this will be his first World Championship, putting up some unofficial world records at Nationals this year. And in the men's junior, Jason Lau, he bombed last year in Finland, so we're looking at kind of putting together a better package this year. His training is looking great. Clifton Foe, Josh Hancock. We all know our boy Josh Hancock looking to come back from his bomb last year to win it in his last year as a juniors. Justin Smith, Nick DiNardo, Jackson Spencer, massive lifter from Ontario, Jake Ripko, and Evan Shaskin, our 120-plus junior. Fantastic team. Looking forward to working with them. We're already doing a lot of prep work in terms of getting them ready, getting them geared up. And I'll tell you this, guys. We're going for some podium team finishes this year. We're primed and ready to take those spots, so we're going to do it. And that's your bi-weekly powerlifting wrap-up. This week on the podcast, we are so lucky to be sitting down with Aras Kvedaras. Did I say that right, Aras?
That's actually pretty good.
Good. So we're sitting down with Aras here, and for those of you who don't know, he works very heavily in the powerlifting community, mostly on the rehab side, and traveling on some of our international teams, working with our high-performance athletes backstage and making sure that they're primed and ready and moving well before they go on the platform. And if there's any issues that come up, he's working with them basically in the moment. So has quite a broad level of experience in powerlifting. We'll get him to touch on that. But first, Aras, how you doing today?
I'm doing well. How are you guys doing?
Can you tell us just a little bit about how you actually got involved in powerlifting? I actually don't know this story. I just kind of seen you around for years and years and years, and kind of a familiar face. Can you tell us how you got involved?
Yeah, probably about 15 years ago, I started just working out with a guy, and I've always liked lifting heavy, and he liked lifting heavy. He was Andy Childs, and he competes in the CPU, and we had been actually training for a couple of years, and then one day he said, you know what? I think I want to try a powerlifting meet. And I said, that's cool. I think I will help you as much as I can. So I just started looking at what was happening to him while he was training, and then started learning from there. That was probably my first nationals I did was 2006 Chilliwack. So that was probably 2 years before that. What I basically did at that point, I knew I was very much interested in the sports end of treatment, and I've always liked strength. I've liked strength since I was a kid. And all the sports clinics, when they start doing dynamic things, they always do gait analysis, usually on the way someone's running. So when someone runs, it should be a full body activity, and then they would start looking at, well, what's not working correctly with the person's run. And I learned how to do that, spent lots of hours learning how to do that. But then I started thinking, well, if they're doing, and they would look at, one group would look at the person run, and they say, well, this is too tight here, their knees are together, so we have to address that. And then someone else said, well, why is that too tight? We got to address why that's too tight, and then the things will right themselves. So I started thinking, well, why do you have to limit that type of thinking to just running? So this was about the same time I was starting to roll with Andy with his lifting, and he just let me, as things broke down for him, so that doesn't look right. So I would say, well, that looks like this isn't doing its job. So I would examine his strength. That was either right or that was wrong. And then I'd have to make sense of why did that not look the way it was supposed to look. So then that would direct me between a failing structure and muscles trying to help and opposing muscles getting tight. So the way the person, what he was breaking down, and then when I learned from other people, it's consistent. When something fails, it has a certain look. So I basically went through and started looking at what people need to, what way it's supposed to look, and which muscles work at different parts of each lift, and just started analyzing it from there.
So what I'm actually getting from what you're saying here, Aras, is you start to develop a framework around rehab in the context of powerlifting, which, it's kind of this niche sport and not a lot of, dollars are going into it. And so, there hasn't been that long history of, rehab science around it. But you, back in 95, were starting to do some early work around developing a framework of, like when I'm looking at somebody squatting, benching, and deadlifting, I'm seeing these things break down, and you can actually start to develop a framework of why that might be.
Exactly. It's exactly. And I had never seen anyone do that before. But just following the same rules of gait analysis of how things change and what you need to do bring back applied to powerlifting. I started realizing, okay, what we learned in school, I learned everything that I know what they taught in school. There's more to this. So therefore, I need to learn beyond this. And I just started looking at consistent things from what I learned in sports and what I learned in school and what I was seeing on my treatment tables, and just started rolling with that. And then when I started getting more in training with Andy as a powerlifter, then I started really seeing the strength issue, how it always comes down to that, because it really, right, whenever my patients come in for anything, they always say it hurts me to do this. So what I hear is something's failing to do this, and there's usually always a strength issue behind it, and then it all comes together from there. The following the rules I learned from the powerlifting in terms of this is the failure and this is the reaction to it was so consistent that I could now apply this to everyone in society, and it's really ballooned from there.
You very much zoned in on powerlifting, as far as I know, at least. You said you've been coming to our national championships, I think, every year since 2006.
I missed 1 year. I had to miss 1 year, the Vancouver year, but yes.
Oh, okay.
Otherwise.
But still, and most of that on your own dollar. And you come to these events and you help everyone, right? Anyone who asks you. In fact, this year at Nationals, at our hosted Nationals, I saw you helping the security guard. The security guard asked you some question about his back or something, and you were helping him. Yeah. So, I mean, you're a very unique resource that we have in powerlifting, and I mean, I hope it's a little bit of a symbiotic relationship in that you get to see so much lifting, and that helps you to refine, especially, I guess, early on, right?
Oh, absolutely. I'm still learning. I still see the way different failures look, and then I confirm it with examination, so I'm still learning. Yeah, it never ends, but the thing is, I'm actually using you guys now. I can actually list you guys as my continuing education for my as a chiropractor. Yeah. So you guys are it. But I mean, what I learn, I just translate it to my office, and it makes my treatment of my patients that much better as well. So it's definitely a symbiotic relationship. I've gotten an awful lot from you guys. You guys have really helped refine my thinking.
I think this is just, going back to learning on the job, so to speak, right? You're learning in you're learning in the classroom, which is one style of learning. You're learning a lot of theory, and then when you actually get into one sort of specific context, and you're able to learn on the job, you start to develop, as we said, that framework. So can you talk a little bit about how you go about assessing people in the moment, at meets? And we can talk about just nationals this year because you were, again, at our national championships, and you were working with a lot of people. So somebody comes up to you and they're in the middle of they've just done their first deadlift, and their, back goes out or something, and they're feeling a little bit of pain and something's not right. Can you go through that process of how you're actually in the moment, you're diagnosing and you're assessing, and then it just seems like you have a way with allowing, treating the athlete in the moment and allowing them just to get back up for the next attempt, their second attempt, their third attempt, so they can finish the meet. So can you talk a little bit about how you go through that process?
Sure. What's ideal is if I can see them do the attempt that failed, or something where I could actually see the failure, because different muscles work. Like when you do a lift, it's not all muscles at once. Different muscles work through different parts of the range of motion, and my brain works like a flow chart. So if I see a failure happening in a certain part of the range of motion of a lift, and I know that this is the muscle that's really important at that point, then okay, so that looks like it's failing, or that's the way a reaction to a failure. Then now I have choices. Well, what makes it fail? So then I would go, okay, so that looks like, for instance, rectus femoris failure. Well, what are the things that will make rectus femoris fail? Are there an L2-3 problem, namely a ligament entrapment, or a popliteus not doing its job, or the muscle itself got really injured? So then it directs me where I need to go. So then, therefore, if I now know what failed by the way it looked, and confirmed it with a test, and then now I figured out why it failed, then I can do something directly right then to help the why. So it's stimulate the failing muscle. If I can address the actual mechanism, like an entrapped nerve, and then also deal with any tight antagonist, because that will also interfere with the muscle. So it's just like, if I can see it, that's the easiest thing for me to do. Oh, that person in the hole of their squat shot their backside over to the other side. You move to your stronger side. All right, something made glute max fail. Glute max fail, what are my options here? L5 or S1 problem, open SI joint, or actually a reflex up from the top of the neck. And then I just work through that, address it, and then see if I can bring the strength back right away.
And I remember at Commonwealths, you were part of the, you came, you helped out our athletes, and you were every single. I mean, we had a podcast where we had all the coaches come in, and we were all just saying how it was such long days, and we were coaching for this this many hours, and we had this many athletes that we were working with, and you were equally part of that whole dynamic. You were back there every single session from start to finish, working with every single athlete that had an issue. But I do remember that you were getting your exercise because you were running from the warm room all the way around to the front of the platform to watch some of these athletes, do their lifts, so you could see, how their movement looks and where they're breaking down. And then you would run back to the warm room to assist.
Yeah.
So,
Yeah, I was gonna say, even just nationals there, for good examples. Like I don't know if Otis, you remember treating me. I hurt my shoulder was all range of motion was kind of shitty there, and you were watching my movement pattern as I was warming up to go out for my opening bench attempt, and I just let you know what the issue was, like you understood, and then just watch me as I did the movement, and you like pretty much, boom, right there, you just knew what was wrong. And yeah, you treat tons of people daily. I mean, for me, for example, I ended up going out and PRing my bench press after taking, I think it was a few weeks off, just because I hurt my shoulder there, and coming back for nationals and pretty much hoping for the best. And yeah, you definitely helped me out, and I hit a PR, which was I did not think I had that in me on that day, right? So it's just things you can do right there in the moment. It's definitely unique, and I mean, you understand the movements, which is a big plus there compared to possibly some other chiros and positions, and maybe didn't understand, like some people deadlift differently, bench with different grips, so they might just be thinking about maybe a closer grip or where I'm much wider, and they don't understand that, saying, oh, I hurt my shoulder, but they don't understand like the movement, how I do it, for example, compared to some other people, right?
And exactly what Steve is saying, like it's so important that somebody, whoever you're surrounding yourself with, understands the context of the sport, because like you said, there's such specialized movements. Yeah. And, there's a huge difference between somebody taking a wider stance sumo and a more modified stance, or grip width on bench, like you said. I mean, it can be they're the same movement, but they can
different
be
muscles
very,
are working,
very, very different.
Working harder than others, right?
Absolutely.
Yeah.
And that's the type of thing I have to consider that then. With that shortened grip or stance or whatever, who is really being stressed here? Who's going to be exposed?
Exactly.
Right? So you'll know right away. If it's the easy thing about your sport is that everything's done to a limit. So if it's going to fail, you'll see it right away. Oh, yeah, there it is, type of thing. So
besides treating Steve at nationals, you've worked with probably every top lifter in Canada, if not almost every, if not every top lifter in Canada. And, even at international events, you help other countries at times. I just, I think back to a number of times you helped me. It made a difference in my day, but like from your perspective, is there any highlights? Like, and I don't know if you can name names or anything, but is there any time where you're like, maybe they failed an opening attempt or something, and you treated them, and is there any kind of moments like that stand out to you? I know it's like so much a blur for you, but
usually if the things that jump out for me are when someone can't, and then I do what I think needs to be done, and then they can. So every time there's a meet, that I mean, hopefully that I can help someone that way. In terms of a highlight, I've done an awful lot of meets. It's usually when someone can't and they can, or if they say something, actually even just like what you just said there, Steve, like your training had been affected, and then you come back and you do things not just to get through, but actually do some pretty decent numbers. I mean, after a meet, I'm actually usually don't sleep that night because I'm just all geared up. I just get really stoked by this. I just love doing this. So I've done a couple of strength competitions myself, and I did fine at them. Nothing special. I did fine. I enjoy doing what I do with you guys way more. So you guys do something, and if I'm able to help, then that's it. I'm not going to sleep that night because I'm all excited.
Yeah, I think one of the moments for me that really stands out, Otis, is, and it was a recent moment at the Commonwealths, we had some fairly high-profile athletes that you worked on, and I can name a dozen of them, but, one of our real all-stars here in Canada, are, hopeful for another medal here this year in Texas is Kelly Branton, and he was having a pretty tough day at Commonwealths. He had a fantastic squat series, but then there was a bench press attempt where a spotter, if you remember, grabbed one side of the bar before the other side, and it caused a little bit of a tweak in his shoulder, and that really kind of offset his day a little bit. and I don't really think he would be able to. He wouldn't have been able to finish given the amount of pain that he was in the moment. And he was normally Kelly is just this positive guy, and it's just his headphones are on. He's just he's all positive and ready to go. And this was kind of the first time where I was coaching him where he was like had some doubt, and he was experiencing some incredible amount of pain. And I don't think he would have been able to finish the day if it wasn't for your help. In fact, I know he wouldn't have, because he told us after that you were the primary reason why he was able to actually get his shoulder back into kind of a working conditioning for the rest of his bench attempts. Then that was affecting his grip too on his deadlift, if you remember.
Yeah.
And you were working with him on his hands and on his neck to try to get his grip in order, and for him to actually pull up a deadlift as well. So. Can you reflect on maybe that moment as well? Do you remember that moment? Can you tell us about kind of what was happening there?
Well, absolutely. I mean, you were correct with when he grabbed when the spotter grabbed the bench on one side prematurely. All of a sudden, because he probably had on the bar 250 kilos or whatever he had on there, and all of a sudden it was all in one arm. That's a heck of a dumbbell. So he really damaged his shoulder. But actually, so with that that was an example of he damaged a shoulder blade extensor, and every time a muscle struggles, and in this case it was because of damage, its antagonist overcontracts. So if his shoulder blade extensor, the one in the back of his shoulder, his mid-trap wasn't doing its job, his pec minor all of a sudden just jumped right in and clamped right down, and that really affected his grip because the nerves for his hand were coming underneath it. So what I was doing with him is I made sure that tunnel was as clear as I could be, but I was more stimulating the injured muscle to make sure that the pec minor could keep as calm as possible so it wouldn't make his hand break free. So because that compression on his chest was compressing on the nerves that go all the way down into his hand. So that was quite an intense moment at that point. I mean, felt bad for the guy because, trained hard, and just this happens sometimes, and spotters just kind of miss the mark there. But, yeah, it was stimulate the injured muscle, try to keep the nerve and the muscle pushing on the nerves as free as possible so his hand had something to use.
So a lot of what you do, Aras, is around nerves. Whereas most people go to a massage therapist or a chiropractor or whatever, and lots of them just treat muscles, right? They're tight. They go for the tight muscle and jam at it for a while. And over the years, I've gotten to know that most of what you do comes down to nerves and nerve paths. And how did you Can you explain how you kind of got to that?
Hierarchy. I think, unfortunately, I guess something by human nature, people chase pain. So if someone says I'm sore here, they rub there. So, but I always ask myself why. Ever since even I was in school at chiropractic college, even when they were teaching chiropractic college, I say, well, why is this happening? And no one could answer it. So I've just been working on why. If the room is dark and you go you go and change the light bulb with a bigger light bulb and it's still dark and you're flicking the switch, the problem's not the light bulb. It's the switch. It's the wiring to it.
Yeah.
So I don't know. There's a hierarchy here. You have no muscle if you have no nerve. So yeah, sometimes the muscle can be the problem. We address that. But if the nerve is compromised in any way, it doesn't matter what the muscle's doing. So it's just nerves are more important muscles. So much so even in an evolutionary sense, if you look at the way we're built, all our nerves are deep to the muscles because the volume of the muscle protects you from the external environment. In an evolutionary sense, all animals realize that we've evolved into nerves are more important to muscles just to protect it. It's less of a problem damaging the muscle than the nerve. So that all our nerves in our body are under the muscle, deep to it.
Now, I'm just a spectator to this whole rehab science, and I try to stay in my lane with coaching, and I tend not to veer out. But would it be true to say that how you actually treat them, if the issue is the actual muscle, how you treat the muscle and how you treat a nerve, are going to be two different approaches. So it doesn't matter kind of how much you foam roll and how much you dig in the muscle. Like, in fact, that wouldn't solve the nerve issue, right? But not only that, you don't really want to be jamming nerves too hard. Would that be the case?
Absolutely. If the nerve is already being compressed somewhere and then you compress it more, a damaged nerve gets pretty sensitive. sensitive to touch, but also doesn't tolerate more pressure. So yeah, it would be easier to self-injure, or if it's not, the nerve isn't addressed correctly. And I've definitely had people come from other offices where people did damage the nerves because they just didn't do it right. So yeah, how you deal with nerves is definitely a different creature, and you have to see why the nerve. Sometimes it's a posture thing. Sometimes it is a strengthening of an opposite muscle to get the muscle that's pushing on the nerve to relax. There's just different things for different problems. But yeah, you can't foam roll out a compressed nerve.
Now, how do you know if it's actually nerve pain versus other pain? Is there something like unique about nerve pain that you can be like, okay, this is something that might need a little bit, something that I can't really self-therapy, something that I might actually need some further assistance with?
For sure. If you end up finding that you use the A word, ache, nerves ache. So if someone has an ache, there's always a nerve involved. So if anyone's like, yeah, my leg aches. It's one thing to be sore at a tendon, that's got its own charm to it, like something that's caused a tendonitis. But if you have an ache, there's a nerve involved. Also, nerves ache at night. If you're laying in bed passively, not doing anything, and you're getting an ache down an arm or down into the leg or whatever, or up into your head, there's a nerve involved in there as well. And things shouldn't just hurt. I mean, it should be reasonable. If something's being treated, it should be better. It should be better in a few visits, or at least see a strength difference in that. The symptoms should be definitely going in the right direction. You have to definitely look at the presentation. Also, the last thing is, if someone has distribution of you have to know the anatomy. If someone has a distribution of pain in certain structures and they all have a common nerve supply, then you also got to think that could be involved. It's not just coincidence that everything hurts in this line. Mm-hmm. So, like for instance, if someone has pain has a tennis elbow, lateral epicondylitis, and they're getting soreness along the infraspinatus tendon in the back of their shoulder, those are both C6 muscles. So if someone presents that way, then I have to, well, there's a common trait there. They're both fed by the same nerve root, so that
Sure.
I would go to that. So you have to know the anatomy.
Now, Aras, you just said something. You said something. I can't remember your exact words, but you said pain is not normal or something. But I'm gonna turn over to Ryan and Steve and just we're all lifters here, and we all at some level and some in our day-to-day training, like we experience pain. Like, would you guys agree?
Absolutely.
So, I guess my question is I'm thinking more along the lines for a novice and an intermediate lifter, because when you get to an advanced stage, you start to categorize those levels of pain and put them into a category that's like, I've felt this before and I've pushed through it and it's led to a bad consequence. Or I've felt this pain and I've pushed through it and I've managed it in this way and it goes away and it's fine. And you start to have that history and experience with pain to know what's good and what's bad. But I guess, how can a more novice and a more intermediate lifter who might not have that, the years and years and years and years in the context, to know, like, when is it good pain and when is it bad pain?
It's definitely how it presents. If something you shouldn't be doing it, the bigger the load, the worse it gets. So if someone's really sore on their warm up, whatever, you're squatting, get down into the hole, and you're feeling your pelvis, feeling your hamstrings, whatever, and you got just the bar on, that sucks. That doesn't feel good. But you do more reps, put on more weight, and it's getting heavier and heavier, so you're warming up. If it starts to feel better, then that's just mess in the tissue that needed to be warmed up from training mess.
Or if it stays the same.
If it stays the same. But if it stays the same, but if it starts getting worse with the bigger load, then you need to examine and make sure that your technique's sound, and also that there's nothing going on. Because if something is failing, it fails with more load. Mm-hmm. But so it's just when it presents. Is this getting worse as I'm getting heavier? Then maybe you need to take a step back to make sure there's nothing going on. If it's like my warm up sucked, takes me half an hour to warm up, but once I got to my working sets, it was actually not too bad. Have at it. Okay. So it's definitely how it presents at the start, or in the working sets, or is it more drama in the warm up? What
do you think some lifters today could start doing to reduce the risk of injury?
The biggest thing that I see for sure with lifters is that their lifestyle shows their lifting shows a lifestyle problem. So they'll come in.
So what do you mean by that?
Well, it's probably the biggest thing, honestly, is things like posture through the day. So yeah, it hurts me to whatever. I'm losing my grip deadlifting. I'm sore in my pelvis when I'm squatting. Whatever. But usually the problem isn't from the lifting. The lifting shows the problem. So posture is a big one. When a bad posture will inhibit muscles, be hard on discs. That's the biggest thing that I see with lifters is they're not actually causing their problems. They might irritate their problems lifting, but they're not causing their problems lifting. It's how they live the rest of the day. Because they lift for 2 to 3 hours at a time, 3-4 times a week, maybe a little bit more. There's an awful lot of time they're unaccounted for the rest of the week. It's what they're doing that time that I find makes a lot of the problems. How they text, how they sit at a desk, whatever.
I totally agree with that for sure. Absolutely.
Aras, I'm going to ask a fairly provocative question, and maybe it's not able to be answered in such a straightforward fashion, but I'll ask it anyways. Powerlifting is an extreme sport, especially at the elite level, and yes. Any sport can be extreme at the elite level. I don't care what it is. If you're doing something at the top of your game, it's considered extreme if you're pushing your body and you're pushing the limits of what's humanly possible. Powerlifting, obviously, you're dealing with maximal loads, and it wouldn't be considered. It's not considered normal. When you get to the extreme end of the sport. So with respect to injury, as you're talking about how lifestyle can often one's lifestyle can often manifest injury or pain through lifting. Do you think that when you get to the extreme level of the sport, you're the elite level, you're going to a world championship and so on and so forth, do you think that it is possible to not have an injury in your career? Or is an athlete going to experience injury at some point in their career because it is just a byproduct of being an extreme sport? You could do everything you possibly could and can do and do all the prehab and everything, but at some point, because it's the nature of the beast, it's the extreme nature of the beast. When you get going, you're 10 years into the sport, you're vying for medals and world records and so on and so forth. Are injuries just part of the game?
I guess it depends on how much you're willing to put the brakes on in a reasonable fashion. It doesn't matter what's on the bar. I've seen an awful lot of good lifters get injured because there was already something there, and they were just warming up to their working sets. It was enough to injure tissue, but it wasn't really hard work, but they had stuff that was already failing in the background. So it's how much a person will be disciplined, even at the highest levels, because at the highest levels of listening to their body as they warm up to see how everything's feeling, and are they maintaining to form. So I've met an awful lot of lifters at the gym, and they want to say they injured themselves deadlifting, and we found out the reason why, and we worked it out, and they want to see if they start getting back to lifting. I'll actually stand beside them looking at what's happening to their body. And I said, if I say drop it, because they're breaking down and they're re-exposing injury again. So if they can maintain the way things are supposed to be done, and they can hold that proper technique, it doesn't really matter what's on the bar if they can handle it. If it's more than what they can handle, the technique will break down, and now you're exposing something to get hurt. So if they can so it's not so much what's on the bar, it's what's on the bar relative to what they can do. So some people are just stronger than others. So if you can, for instance, when you're deadlifting, and if you've had a back issue, if you can maintain that lumbar extension, doesn't matter what's on the bar. If you can maintain it, you're safe, you're fine. And I have never had anyone who's had for instance, a deadlift injury where we didn't follow that, where they had a problem afterwards if they maintained that lumbar extension. So I'll just stand there staring at their lumbar spine while they're deadlifting and see what happens. If I'm just meeting them at the gym with their training, rehab, and getting back to competition. It's how much the person's willing to stop if things aren't happening.
I think in an extreme sport, you get extreme personalities.
Yeah.
And it's hard to tell somebody who is extremely motivated and passionate about pursuing their goals relentlessly, to stop doing that activity or to pull back when it's time to pull back. It's kind of like when you're playing poker. You got to know when to hold them and kind of know when to fold them. Poker reference.
I've definitely had that.
That was nice. I like that.
I've definitely had this conversation where I had to tell someone, listen, okay, this isn't happening right now. So you either miss this week of training or you miss the next 2 months of training.
Yeah.
Your choice.
Yeah.
Right? If it's not there, it's not there. It doesn't matter how much your will is there. You might fake your way around it. Now you're really, well, if you're faking it around it, then you're not going to be as strong because you're using things that aren't going to do the job as well. But also, you don't want to have a big interruption in your training. You have to be. It definitely takes quite a bit of maturity to be able to put the brakes on, even though you have all the will in the world.
Yeah,
but yeah, I've definitely had that conversation.
A lot of people they could be getting stronger and stronger and stronger with like all 3 lifts, and perhaps their technique is breaking down throughout this whole process, and it's going to be, I think it's going to be a matter of time, right? Because they can be getting stronger, but then they're going to be set back a lot longer because like they're setting themselves up for a huge injury, correct?
Absolutely. So
and I think what you're saying there is, you said maturity, and I think it's experience, right? It's something that personally I've learned, right? That it's a lot better to leave a set in the gym rather than take 2 months off, right? And sometimes you never feel it until it's too late. But sometimes, and I've done it a number of times where before a set I'm like, I don't know if I should do this set. Something's not feeling right, and I still do it. And 9 out of 10 times when I do it, nothing happens. But it's that 10th time, where now I have to take 2 or 3 weeks or months off. So I think it's something that if I could preach to younger lifters, is to learn to trust your instincts earlier and leave your ego from making those decisions.
Also, especially with better lifters, it's actually good to also lift with other knowledgeable lifters, because if someone is not doing something correctly, especially if it's not their first time in the sport, they're not doing it correctly because they don't know. It's because they can't. Something's not allowing it to happen. So, this is happening during this lift. Can you correct it? If they can't, then there's a reason for that. That's screaming, it's time to hang it up for the day or stop that lift for the day and have that figure out why that's happening.
Aras, let's just switch gears here, and I think a lot of athletes would find benefit in getting your advice and your professional wisdom around competition day routines, and perhaps you could just share your thoughts on what you believe are the important elements in an athlete's warm-up routine. Warming up at a meet. What should athletes focus on? What should athletes avoid? What do you think that athletes kind of spend a ton of time on that perhaps don't have the greatest impact on their performance on meet day? Are there any things like that that you could recommend or suggest?
There's several things. First of all, you have to be careful stretching, because if you stretch out, some people do all kinds of shoulder and hip stretches, and you have to be careful with some of them, because if you stretch open a ligament, there's always associated inhibition of muscles that happens with that. So now you've weakened yourself. So if during people, it's a meet, you're a little bit more geared up, so people start stretching a little bit more ambitiously, and they can actually injure themselves. I've had a lot of people get injured out of yoga classes. Not against yoga, but stretching isn't just a blindly safe thing to do. Mm-hmm. So I would suggest to spend more time warming up the lifts than stretching the lifts. Even do some more light sets. Also know that, once again, bring nerves in. You're excited. You're about to do a meet. So you got to imagine that your nervous system is working at a little bit higher level. And by doing so, the muscles are contracting a little bit more. So what feels like your normal depth, for instance, in the squat, by how tight it is at the bottom, you're not as deep as you usually are because your hamstrings are tighter because you're geared up. So having good warm-ups at proper depth, having someone, even though it's just the bar, having someone who looks at, that's depth, even though that feels like you're probably going deeper than usual because it's tighter down there, it's not as deep as you think. So I've definitely seen that happen a lot, even with experienced lifters, where they do all their training to depth, for instance, with a squat, but they get to meet day, everything's higher because they're just kind of excited. Mm-hmm. And the other thing that I've really seen that really has a huge effect on meet day is what you eat. You want to eat simple foods. If you're eating foods that have a really big, long ingredient list, especially right after you've weighed in, your body has to process that. And that's a lot of work on your liver. And if your liver's having a hard time, then it will just start generally wiping you out, right? Alcoholics aren't really known for their strength. So you'll see this an awful lot. You'll see this an awful lot by the time the deadlift rolls around, is that they got nothing left, right? They'll get to their opener deadlift, and I've seen an awful lot of people bomb out or just barely get their opener because their body is spent. You've already done the other lifts, so there's already been a lot of work done. But if your liver is also really taxed trying to break down whatever you've sat there and been cutting weight and trying to get to, a lot of people will sit there and have to have a real fight to get to weight, but they feel once they weigh in, it's fair game. They can have whatever they want. Save that junk for after the meet. Eat smart. The meat's not, you weighed in, the meat's not over. You want to have things that your body can deal with easily without using a lot of energy. So simple foods that the ingredient list is the food. You don't want to have a big long. So I don't like a lot of the nutrition stuff where people eat bars and things like that because they get pretty complicated. They take a long time to break down and they take a lot of work for your liver to process it. So I prefer simpler things to be eaten on meet day during the meet. Then afterwards you can have at whatever turns your crank.
Sure. So I know I've heard you talk a lot of people, and you talked about cutting weight, and I know you've talked in the past about hydration levels and nerves. Do you want to touch on that at all?
Yeah. Basically, if you have to, just like if you took a piece of meat and you dehydrate it and put it in like a vacuum packed container where it all gets all sealed up, everything just kind of gets sucked in. I think the same thing happens in our bodies if we dehydrate. If you're cutting weight, all your nerves get entrapped. So when I see someone that's had to cut a whole bunch of weight, sometimes you see people losing 10 pounds in a day, they cut all that water out, all the nerves get entrapped. And I know that if someone does that, I said, oh my goodness, I'm going to be busy today and freeing up everything because everything gets entrapped. It just makes for more drama during the day, and you see people start cramping and all that. But then they just start entrapping nerves, and then now you made weight, but you've now wrecked your day because your body's not working well at all. Because you'll entrap them in your hips, in your back, in your forearms, in your shoulders, everywhere. And I've had to do it like an anatomy lesson with people on meet day because it cut so much water, everything got dehydrated and everything just got stuck. So for sure, if you can, avoid big hard water cuts at the last 24 hours, if you can.
I guess in that same vein, we're talking about meet day prep and things to do, things to avoid. What do you think are some things that athletes can do that the majority of lifters can do today in their training to avoid injury? So are there certain do you find that there's some specific warm-up protocols that some activation exercises that that should be done before you roll into the core lift? So should people be doing a ton of activation exercises? Do you think there should be time spent on stretching post lift, static stretching? What are some things that you think can athletes benefit from? If they start doing now, they might be able to avoid reduce their risk of injury.
I think if someone has a history with a certain muscle that's involved with a lift, they just have a history from before with this muscle, they should do isolated, very light, 10, 12 reps before they start doing the compound lift, whatever the lift is for the day. So you do isolated work with the affected muscle with baby weight, nothing, just to draw blood in there to soften it up. I prefer things softening and lengthening that way than just passively pulling it apart. I also like at the end of lifting. So
just an example, so just going back, so this is before lifting, so for an example, if you find an athlete has a history with glute med shutting off or whatever in their squat, you would just prescribe a ton of clamshells, not a ton, but 2 sets of 12, 3 sets of 12 of clamshells or expand walks or something.
Yes, exactly, just to bring blood in there to soften it up directly. And also then afterwards, after they're done lifting, I actually, to keep that tight muscle part of the team, I like actually people just to go for a walk for 5 to 10 minutes. Just put on a decent pair of shoes, just a pair of running shoes, and stroll for 5 to 10 minutes. When you walk for 10 minutes, you develop a neurological rhythm, and then that neurological rhythm will just quiet all the muscles down, because you just did a lift with something got exhausted. Not everything got exhausted, something got exhausted. If it's bench day, if it's squat day. So if you go for the just gentle stroll, it just calms all the muscles down evenly.
I think I heard somewhere, Otis, that, you know, especially in context of powerlifting, you know, you go in, you train, you do these big lifts and they're maximal weights and whatever, and you know, a lot of strength and conditioning coaches would perhaps program some static stretching post lift. I didn't hear you say that, and is that because you've just had your nervous system is jacked up, and if you do go into kind of some sort of static stretch, you might overdo it, and that's why you're recommending the squat or the walk?
Partially that, but I like the muscles that got something failed when you just did your lift. Something's going to react to it, the synergist to what just you really worked, and the antagonist will get really tight. And then if you go for that walk, it just calms it all down at an even pace. It's the same thing I tell people after they shovel snow, after people that go for gardening, after they move furniture. Go for a 10-minute walk. Some things got used a lot, other things didn't as much. We go for the 10-minute walk, develop the neurological rhythm, and it brings it all down together. It rebalances everything.
I think the jury's still out on this. I don't know. Maybe you could just chime in on this debate. But what about foam rolling and lacrosse ball and things like this? And what's your prescription with respect to that in training? Like I see some of my athletes, you know, doing like 40 minutes of it and so on and so forth, and then, you know, making all these, you know, like pain faces because they're just like, you know, rolling out these really, really tight, you know, painful muscles. And like, I mean, what would be your like recommendation? It's a regular training day. You're going in to squat. Like, are you doing foam rolling? Like, what's your opinion on that?
I've never prescribed it. With foam rolling, it's got quite a broad surface. So the only thing, it doesn't penetrate very well. So you're really only getting anything that's possibly tight that's just under the skin. But you're dealing with muscles that have way more volume than just that. So at best, you're just getting with stuff that's just under the skin. Might free you up a little bit. Once again, I'd rather just, if you've got something that's tight, use the muscle nicely, easily for a little bit to soften it up that way. With something like a lacrosse ball, it has much more of a point to it because it's a ball. You can crush a structure in there. If you catch it right on a nerve, you could hurt it. So I've seen people cause injuries with that. So I never prescribe those things. There's not an enormous amount of benefit that I see in the big picture, and there's also risk with the ball for causing a really good injury. And if you crush a nerve and you really damage it, well, then you're going to enjoy that for half a year.
Do you think it's like beneficial at all? Say if some muscles tight when you're, say my quads tight when I say do a set, and maybe say in between sets or something like that, just do a little bit.
Yeah, if you're doing some full rolling, it'll help a little bit. Just so realize it's just you're just getting what's under the skin, and that's about it. So if you've got look at symptoms as a number of 10, what I'm feeling like right now on your quad is a 10, and you foam roll. Well, maybe you'll knock down with the stuff that's under the skin. So now you're feeling an 8, and that's fine. Yeah. But it doesn't fix anything. It'll just kind of free up for that moment to kind of get you, just bring down the symptoms a little bit to help get you through.
Okay.
There's a mechanism. Yeah, if something's failing or something's reacting to a failure, it affects blood flow in the muscle, and as soon as that blood flow drops down to a certain point, it sets off an inflammatory reaction, and then every time there's an inflammation, adhesions are laid down and makes a mess. So it tells you there's something going on there. My office, my rule is, if something isn't 80% better after the 3rd visit, I've missed something. I got to look for something else.
Oh, that's a good rule for anybody that's seeing any sort of rehab specialist or something like that.
So I'll just roll off that. You mentioned your clinic, and I think you have 2 clinics, right?
I do. 2 locations yes.
So go ahead and pump up your clinics.
So the name of my office is the Active Relief Center. I have massage therapists and physiotherapists and other chiros here. They all practice the same way. I've trained them all. They all have to practice with my philosophy. They're all doing a really good job. I spend a lot of time with them, training them off hours, just because what we're doing just holds so consistently.
And where are your clinics?
I have one in Hamilton near McMaster University, right off the highway, and the other one is in the booming metropolis of Hagersville, Ontario.
So then,
Yes.
if no one's in the booming metropolis of Hagersville or in Hamilton, and they can't make the trip, is there a specialty you refer distance peoples to? Like, do you prefer people go to see? I know any practitioner of any therapy can be good. Like, you can have a good massage therapist, you can have a bad massage therapist. Is there something you would generally recommend? Like, do you think acupuncture is good? Like, you know what I'm saying? Most people can't come see you because you're only in Ontario, and you don't train anyone outside of Ontario. So who would you recommend people go see if they have issues? Is there a specialty you like?
The specialty I like. No, it comes down to the individual, the philosophy of the individual. I've seen crappy in everything. I've seen good in everything. So, it just, if the person's willing to listen and willing to acknowledge what they're doing is or isn't working, they're not just doing the same thing every time. If someone's only tool is a hammer, then everyone looks like a nail. They have to be willing to have a variety of things, address different problems. If they're not, they need to be able to direct it accordingly. They need to be honest if something's working or not, as opposed to just giving excuses of why things are still hurting. They need to be able to say, yeah, this isn't getting rid of it. So the patient just has to keep their eyes open. Is this person really trying to get better, or is this therapist really trying to get the person better, or are they just kind of stringing them along? And unfortunately, there isn't much of a standard for that. So it's really up to the patient to be critical and take ownership of it for themselves.
I mean, we kind of covered a little bit. You answered some questions of when people should seek treatment, but I think we're going to have you kind of type up a little document on, kind of your guidelines on when you should seek treatment versus when you might be able to push through it. And then we're going to go ahead and toss it on the website for anyone to download and appreciate. It's a very good tool. I mean, Aras is obviously very knowledgeable, so I think it's going to be an excellent resource for a lot of different people.
We want to thank you for coming on the podcast. We really appreciate all your nuggets of wisdom, and we'll be sure to talk with you again, because there's obviously so much to talk about in the context of rehab and prepping, what to do in training, what to do in a meet, and sorts of best practices. So thanks for coming on, and we'll talk to you again.
My pleasure. Thanks a lot, guys.
That was awesome.
So that was our conversation with Aras, and he's putting together a document for our website for download. Steve, how can we get our hands on that document, and what exactly is he putting together for us?
So go to the website at www.canadianpowerliftingpodcast.com under the downloads there. What Aras has decided to put together for us is going to be a little document on when to push through injuries and when to maybe lay back and head to the website, and that is a very, very good and going to be very informative.
And Ryan, what do you want to say to end off episode?
What do I want to say? Aras is one of my favorite people in the sport, in that he's not a lifter. I mean, he does train, but he's not an athlete. He puts in his own time, in his own dollars. He travels not just to nationals, but he's traveled to I don't know how many international meets. And puts in as long a days as many of our coaches that are being paid for it, and just does it to help athletes. I think that makes him one of the most amazing people in the sport to me. And I've known him for a long time, and I think he's an absolute amazing individual. So I think this was an awesome episode, and I'm really happy to have gotten him on the podcast.
Well said, and just like always, every other Thursday, you can catch our next episode. Don't forget, # Canadian Powerlifting Podcast if you want to be featured on the podcast.
Like and subscribe to us on iTunes and other podcasting apps, as well as on YouTube.
You've been listening to the Canadian Powerlifting Podcast, the podcast that brings you the best of powerlifting in Canada, hosted by Stephen Cassioli, Ryan Stinn, and myself, Avi Silverberg. Please follow us on Instagram and check out our website for some great free powerlifting content at www.canadianpowerliftingpodcast.com. If you like what you heard today, please rate our podcast on iTunes, and don't forget to listen to every other Thursday for a brand new episode. This episode was brought to you by LVD Fitness, where LVD stands for Lift, Visualize, and Dominate. Visit lvdfitness.com to pick up your CPU-approved swag and follow them at LVD Fitness to find out which events they're coming to near you and to catch a sneak peek of their spring collection.